Hello, my name is Chezo Nojang. I'm a family nurse practitioner student from Coppin State University. I am presenting a video on my winter course Nursing 620, and this will be on the theory Betty Newman theory of system models and how it applies to my non-thesis project for this semester. On the introduction, I want to just talk about what the theories, what are her construes of this theory. The main construes of the theory or model is to provide a holistic overview of the physiological, psychological, sociocultural, and development aspects of human being. And how does this theory apply to my non-thesis? We're dealing with the topic is on health literacy and on older adults living with type 2 diabetes and how they can better manage their disease condition. So how I see this theory being applied, Betty Newman has three levels of nursing intervention, and we have primary, secondary, and tertiary, which I will get into it. So that is how it relates to my project. So the three levels that I just mentioned, the primary, secondary, and tertiary, we're going to look at primary prevention. We talk about stressors at this point is suspected but has not yet occurred. So an example of that would be a family or a female that has a family history of breast cancer decides to do a mastectomy even without being diagnosed with cancer, just for prevention method. So that will be considered a primary prevention. While the secondary prevention is when it has already happened. In her case, she's been diagnosed and they're going through the treatment. And while the tertiary part is after treatment has been done, let's say she was diagnosed with breast cancer, treatment has been done, what are the treatments now that we do to bring that person up to par, to maintain bring them back at least their optimum wellness. And what I look at it is, with my project, with my older population with type 2 diabetes, they already have the condition. Diabetes has a lot of different complications. So what I'll be looking at teaching them is looking at those that have a family history. I want to start with the primary prevention to see how they can prevent themselves from the things that they at-risk conditions. There are certain conditions that they cannot change, like their age, their gender, but there are certain things that can be done to help to slow or to prevent those conditions if you already have a family history of that. So that is what I'm looking at my project. But when it comes to my older population, they already have the condition. So now what I'm looking at is the education that I will provide to them. This population is at risk for low health literacy. So how can I simplify the education that I will be giving them to help them be able to manage their disease condition, to make it such that they can live a high quality lifestyle or improve their health qualities without suffering from a whole bunch of complications that comes with their disease condition. So that is something I'll be looking at, and that's how this theory is going to apply to my non-thesis project. Some of the main major concepts in this theory, it talks about the person, the system model talks about four concepts: the person, the nursing, the health, wellness, and environment. And with the person, what the model is talking about, it consists of a multidimensional and a multi-layered subsystem, with each layer having 5 subsystems. These systems, they include the psychological that I earlier mentioned, the physiological, sociocultural, spiritual, and developmental process. So with the nursing part, what I'm looking at, how it relates to my my non-thesis project would be, I'm treating that older adult, I'm treating that individual with the health condition as a total person. So I'm not just looking at how they can take care of their disease when they are sick, but I'm also factoring in like the support, how they can get external support, maybe what they can do if it comes to like making assisting them with their doctor's appointment, or seeing how they can get additional extra help from the community. Like putting all of those things together, and that is what I'm looking at with this population. So as a nurse practitioner, I will not be treating the person as a part, but I'll be treating them as a whole. So that is what Newman emphasized. And in order to do that, I have to look at like my perception about the care, also addressing the perception of the individual, making sure that they are at the state of mind that they are willing to address the condition, because that helps to bring positive outcomes. Just like we set a goal on what we're looking at and how, and what I would do also is meet each person at their level of reasoning and try to bring them up using simplified method. We look at the health, maintenance of wellness, and disease prevention. I already addressed it by addressing the people with family history on the things that they can change, lifestyle modification, because individuals with diabetes have, the key thing is how to manage the disease condition. And it can be challenging, especially to those with low health literacy. How am I going to apply the clinical practice part of it? By me engaging with my population group, we'll be able to set goals, simple goals that will help to set this. But first, I have to make sure they are in the state of mind that they're willing to engage in the practices. And no better way to do that than to be get them involved in the care. Diabetes is a condition that has affected a lot of people, and like statistics that was put out by the International Diabetic Federation, it estimated 700 million people will be affected by diabetes by the year 2045. It also stated that 1 in 11 adults currently live with diabetes worldwide, making it 10 million more than in 2015. So looking at this, and they say 8 million more adults over age 65 are living with type 2 diabetes. So this is a very serious problem. The cost, we're looking at the cost, we're looking at the poor health condition that these individuals with all this they live with, looking at all the complications. It can cause blindness, it can cause stroke, it can lead uncontrolled blood sugar, it can lead to like I said, the blurred vision, because it leads to leaking of blood vessels into the retina, and many other complications. It damages the kidney, and these people end up being on dialysis and having strokes because of the high blood pressure. So all of these things are things that can be managed if the individual is trained properly, or if they have the knowledge to be able to manage their condition. So I find this theory very, very relevant, important as it relates to my research project, my non-thesis project among that group of adults 65 and older. So I think I look forward to doing carrying on that project, and I look forward to seeing hoping, and I believe that there will be some possible results coming out of it. This is going to help to reduce their hospital visits. I'm hoping this will also help them to be able to manage their disease condition and live very healthy lives and live long. Thank you very much.